Do you suffer from painful sex? Is that why you are avoiding sex? Do you feel ashamed? You think you are the only one who has pain, who has been cursed with pain during sex? And you get depressed because of that? Then listen, this is the video for you. I want you to watch the video so you know why there is pain during sex and what can be done about it. Hi, my name is Dr. Mona Hardas. I'm an OBGYN from Flint, Michigan area. I am a cosmetic gynecologist. I'm a trained robotic and minimally invasive surgeon. I'm an author and I'm also a social media educator. I wanted to talk today about pain during sex. It's a very common condition. About 10 to 20% women sometimes in their life can experience pain during sex. Now, pain can be at the penetration. The pain could be deep-seated. It could be in certain position. It could be at all the time, or it could be intermittent. There are several different ways the pain can present. And you know why it happens? There are several causes. So the commonest cause of painful sex is vaginal dryness. Now this is a superficial pain. That means pain at the stretching or at the entrance of vagina during penetration. Now vagina is lined with all these glands which produces secretion when you are sexually stimulated. Anything that decreases the secretion can cause vaginal dryness. And these glands are usually controlled with the hormone estrogen. Now there are times in our life when there is decreased estrogen. For example, postpartum, right after the baby is born, when you are breastfeeding, when you are on certain medications which decreases the estrogen, like we treat people with endometriosis, with fibroids, with certain hormones to actually decrease the amount of estrogen, that can decrease the secretion and cause vaginal dryness. Sometimes low dose birth control pills, which has a low dose estrogen, can also do that. And then the time in your life, which is called perimenopause or menopause, there's a decreased estrogen secretion. So because of decreased estrogen, there's a decreased secretions from the vagina, there is vaginal dryness. Certain conditions, like some women get recurrent yeast infections or bacterial infections. Some people get recurrent urinary tract infection. All this inflammation in the vagina can affect those glands and decrease the secretion. And that's why these women have pain at penetration, or it just feels like sandpaper, it feels like a friction, and it's not pleasurable at all. Sometimes there is a structural problem, we call it. Like, some women have a very tight hymenal ring, which doesn't stretch. So first time when they have sex or whenever there's an attempt at sex, there's pain at penetration. Some, this is rare, not common, but can have something called microperforation, or a very small opening of the hymen. And again, same thing happens, that the penetration is very difficult. Some women have vaginal septum. That's like a tissue, extra piece of tissue, I would call it, growing in the vagina, or if they're born with it a lot of time, and that causes difficulty. Some women have we call uterine prolapse. So the uterus is like halfway down, it prolapses, the bladder prolapses in the vagina, and that can again cause like a mechanical obstruction and pain in the vagina. Sometimes after childbirth, if you had an episiotomy or had, say, vaginal lacerations which were repaired, and in some women they heal with scar tissue. That scar tissue cannot stretch, and anything that stretches the vagina will cause pain up there. So these are kind of few conditions which can cause superficial or pain at penetration during sex. Now, once you have a painful experience with sex, then your body, your brain, it's a smart organ, isn't it? It will send these inhibitory signals to the muscles of the vagina, we call perineal muscles, which at the attempt or even thinking about having sex will get into this tight contraction and will close the opening of the vagina. This in medical term called vaginismus. I'm gonna have a video on vaginismus in the next time, and I want you guys to watch it so you know more about vaginismus. But this involuntary contraction, the woman is not doing it herself. It's her brain involuntarily making this vaginal muscles go in spasm, causes pain. Now, most of the time, the commonest reason is past bad experiences. It could have been a pain during sex at first attempt. It could have been a sexual abuse, emotional abuse, or even a very painful exam in a childhood, which have left these bad memories and will make just sex painful and psychologically can affect the woman. There are certain conditions, medical conditions, like fibroid tumors or endometriosis or ovarian cyst, and just like I mentioned earlier, uterine prolapse, which can cause pain during sex. It's a deeper pain. And some women have that pain in certain positions only and not all the positions. So there are so many different causes of pain. So if you have pain, I really urge you to see a gynecologist. So when you go to them, they'll do like a detailed history. They want to know about your medical history, your past surgical history, your obstetric history about your deliveries, was there episiotomy, the medications you are taking, because some of the medications, as I said, will decrease estrogen, right? They would want to know your social history as well. And then they will do an examination to find out, is it vaginismus? Is it superficial dyspareunia? Is it deep dyspareunia? Is there any structural problem? What is it which is causing pain? Are there any medical conditions which is causing pain? Because once you get the right diagnosis, treatment is easy. Now, when I say easy, it's not quick. It takes time. And it's not a single treatment. It's a multi-modality treatment. We're going to need different things. We may need, say if there's a vaginal dryness, we're going to need lubricants or estrogen supplementation. Maybe we need to treat your vaginal infections. Maybe we need to talk to you. If it's a psychological problem, we need to talk to you about, give you therapy, put you on antidepressants. Maybe you need a couples therapy. There's a treatment called desensitization, where it helps a woman be desensitized to this painful stimuli, and can be given as a psychotherapy. And there are so many ways it can be treated, but it needs a right diagnosis. Now, on your part, what can you do if you're having pain? Definitely make sure there's enough lubrication. There are so many products available on over the counter, so you can use either a water-based or a silicone-based lubricant. Make sure that there is enough time spent in foreplay, so there is vaginal secretion and there is not dryness. Relaxation techniques help. There are certain physical exercises and physical therapy which will help in relaxing those muscle helps. The perineal muscles can be taught how to relax with the physical therapy. Sometimes we give you dilators. So by you, the dilators come in a set of different sizes, So once you know that you can use a larger dilator, without pain, the sex is not gonna be painful. So we can teach you that. Kegel exercises help in relaxing and making those muscles looser. There are different ways of doing it. So you can try those things at home. If you have pain after sex, use ice pack, use some over-the-counter pain medications. But please go see a gynecologist. Find out what's the cause of this pain. Don't suffer in silence. I told you, but 10 to 20% women have it. But a lot of them, they just don't talk about it, and then that causes problem in their life. They can get depressed, get self-conscious, and a problem in their relationships. So let's not go that way. Please call and get that help.